Hi, and welcome to Module 13, where we will be discussing targeted health outcomes. In this module, you will understand how to develop a health improvement plan, how to engage community members, elected officials, organizations, or whomever your stakeholders of interest may be for your health improvement plan, and identify considerations for developing goals for your health priorities that you're going to identify. So, steps in creating a health plan. Understanding your community requires the background that you completed in assignment 1. It's basically a lit review. What are their interests, concerns, and health issues? How do you know how big of an issue is it? That was actually assignment number 2. What are their unmet needs and how do you fill that gap? That's based on your lit review and, importantly, your theory. And then using the metrics to assess performance, that's actually assignment number 3. So what are the barriers and facilitators? What individual and community level interventions may be developed if you assess your population with these metrics? And then finally, in 4, you need to identify your immediate stakeholders and engage them. So how will you access the patient population? And educational sessions on your goals and how stakeholders can help. Can they help you mobilize your patient population? And then importantly, we're also going to talk about delegating, because a health plan where you understand the background means you understand that it's a pretty big issue, that it affects a large number of people in your population. And so you really need to understand how to delegate and pick out those organizations or other stakeholders that maybe you could partner with, maybe you could talk with and get them to take on a certain element of your health plan. And then who are the long-term stakeholders? If you identify a health concern of interest to a certain number of stakeholders, could they potentially take on your case for the long term? So you want to think about sustainability. Health resources. So in terms of health resources, you want to consider the social determinants of health. And at this point, you know what those are. Race, ethnicity, social class, education, access to resources, including health care, sexual orientation. How do all of these factors affect the ability of your patient population to follow your recommended guidelines? So we know, again, that people cannot follow your recommended guidelines if there are other barriers to implementation. So how can you help them make a healthy change? First, you need to identify the social determinants of health that affect your population, and then identify specific barriers that they face. And then once you identify those barriers, you have to think about solutions to either better reach them, provide access to healthcare or educational materials, or transportation, or whatever it is that they need to follow your recommended guidelines. Based on the social determinants that you've developed, which you have a pretty good understanding of at this point, your plan should provide clear, specific, realistic, and action-oriented goals. So they should be clear in the sense that any provider or any community stakeholder that you hand them to should be able to read and understand them at a glance. They should be specific enough that you can develop action-oriented goals. If you have broad goals like, I plan to improve the health of my community, that's a great goal, but that is really broad and would take you 25 years. You need to pick a specific part of health that you wish to improve. It needs to be realistic based on the social determinants of health. Could you actually improve that particular part of this population's health based on what you have identified? And then come up with some performance measures, because you have goals to improve a certain aspect of health, you have objectives and strategies, and now you need performance measures for the priorities. Performance measures, goals, objectives, and strategies include things like in the short term, where you define what that is. Is that 1 year? Is that 6 weeks? Is that 2 years? In the long term, is that 2 years? Is that 4 years? Is that 15 years? And be realistic based on the problem you've identified, the population you've identified, the barriers that they have, and those partners and stakeholders that are going to help you get there. You need to put an emphasis on evidence-based strategies. We don't want to chase a plan that is not 100% known based on the evidence that it's going to work or it's going to do something. And this is based on your literature review. So you want to pull from your literature review evidence-based information that you know is going to work with this population and develop your strategy from that. And then a general plan for sustaining it. How will you continue it? How will you continue it when you're not there anymore? Do you have any buy-in from the organization and or the community? And that's the strongest part. If you can begin a plan, set it in motion, and find funding for the plan in the community, maybe the township will help support it. Maybe a hospital will help support it. Maybe you could train nurses that will have some of their time devoted to implementing this plan with the population. Whatever you can do to strengthen it and make sure it's sustainable, you need it to go on without you. If there are other programs in the community that you can attach 1 or 2 extra goals to and give them the evidence that this is what they really need to be doing and that this is really going to make it a huge improvement in their patient population of interest, then you've created a sustainable plan, which means you don't have to be there in 15 years for it to work. So here's an outline of an example plan. An outline is in red because this is simply an example, and it's actually a bunch of examples on how you can write goals, objectives, measures, and outcome indicators. So let's say our goal, which you'll notice is pretty specific, is to reduce the incidence of pediatric asthma in Delaware County and its effects on children's lives and quality of life. Your objective would be to target the children at greatest risk for pediatric asthma. So that would go back to your lit review. Where do they live in the county of your choice? Who are they? What's their racial, ethnic, educational? What are their parent characteristics? How do you know, right? B would be to reduce visits to the school nurse for asthma attacks by 30% within a year. C, reduce hospital emergency department visits for pediatric asthma by 20% within 2 years. So you can see when you have a small goal of just working with a school and a school nurse versus a larger goal of hospital emergency department visits, which are a little less beyond your control, and improving quality of life for children. Improving quality of life for children is a pretty big goal, but what you're assuming is that if you can target the right kids and their parents, reduce their trips to the school nurse, and reduce their hospital emergency department visits, you are improving the quality of life for those kids with regard to asthma. Measures. You have to make sure, if you're specific, that you're measuring the right thing. Pediatric Asthma Risk Survey. That's going to include environmental, so where they live, what they're breathing, what chemicals are around them, what companies are around them, what is their socioeconomic status. And it also measures behavioral components. So what do their parents know about asthma? What do the children therefore know about asthma? How are they managing it? What are they doing to reduce their risk? You would cite and attach both of those surveys. The percent of asthma attacks last year in school. So in order to tell whether or not you've reduced visits to the school nurse for asthma by 30%, you need to know where you're starting from. So what's your baseline? What is the percent of asthma attacks last year? What's the current percent of cases of pediatric asthma in the emergency department last year? Again, that's the same thing. If you want to reduce hospital emergency department visits, you need to know what's the current percent of cases in the ED last year. And then you're going to go forward based on your goals, your strategies, your program plan, see if your program works, and then you would measure them again, right? So if you have a short-term plan of 6 months, which is probably not long enough for this type of health plan, but let's say 6 months is your short-term goal, then you'd need to measure the percent of asthma attacks currently 6 months after you did your plan, and then currently in pediatric asthma in the ED. Then finally, you would need some sort of quality of life survey because your objective is to improve the quality of life for children. So if you want to see any improvement, you're going to need to measure before you begin your plan, then after you implement your plan. And again, you would attach it because every measure that you use needs to be attached. And then outcome indicators. How would you measure the outcome? Percent of families who received educational program on asthma within 1 year. That comes back from your lit review of it's not just the children, but it's the families and the parents who need to know about pediatric asthma. Your objective A. The total number of visits to the school nurse during the school year, the total hospital ED visits by children for asthma, and then the quality of life from baseline to 1 year or whatever your short-term and long-term goal is after your plan is implemented. Strategies. A strategy, I've listed a couple of them here to give you an idea of what they are, is to, within this example, ensure families of children at risk for pediatric asthma receive information on asthma signs and symptoms. So your strategy is to educate the children and the parents. Ensure teachers and children have inhalers and knowledge about using them. So in Lit Review, you've identified that these children need immediate access to inhalers. In order for that to happen, you need to make sure that the children have them, the parents have them, and the teachers and school nurses have them. Ensure parents have necessary knowledge to help children manage the disease. When they feel something coming on, if they identify a trigger, make sure that they're educated. Assess and reduce environmental triggers at home and in school if at all possible. So whatever may be causing it at home, whether it's dirt or dust or mites, in school would be the same. Of course, you could also identify that living in a low socioeconomic community with chemical or other hazards in the community could also cause or exacerbate the problem, and that could be written up in your Lit Review, that you would need to change some sort of environmental policy. And so then finally E, develop environmental policies for the county, the township, the state to reduce pollutants in the next 10 years, which is going to help everybody, not just those at risk right now. Tactics. Identify children and families who are at risk for and who also have asthma. Deliver age-appropriate education to as many as possible. Your target is going to be greater than or equal to 80%. Secure grant funding and partners to implement asthma triggers assessment and education in these children and homes. Use assessments, evidence-based and targeted metrics, measures, and assessments to develop a tailored plan to reduce those triggers, and then disseminate all the information to stakeholders. Again, you want to try to get buy-in from the community, from the township, from the state, with money to pay for your program, to test it, and then also to sustain your program. Performance indicators. This is how you're finally measuring what happened. Percentage of children or parents at risk receiving the education in one school year. So did you targeted more than 80%? Did you get them? Percentage of homes reached by the asthma triggers assessment. This is all directly following from your tactics. Percent of homes receiving funding to reduce the triggers. Did it increase quality of life? Number of stakeholders you were able to engage or involve, development of a sustainability plan for educational programming, and some sort of environmental policy or environmental policy recommendation to reduce industrial pollution in the community. So think about those and how you can put those in a plan within the topic and patient population that you have identified.